Hello everyone, today we are gonna discuss subacromial impingement syndrome. This is a very important subject because it's so common that 44 to 65% of all of the shoulder pain are due to a subacromial impingement syndrome. So you can imagine how common this is and how important it is to address this particular syndrome. First of all, I want to say that subacromial impingement syndrome is not a diagnosis in itself. In fact, it includes many different pathologies which affect the subacromial space. Hence, subacromial impingement syndrome. These are things like partial thickness rotator cuff, tears, rotator cuff tendinosis, calcific tendinitis, subacromial bursitis, and also bony spur in the shoulder joint itself. So if we start by defining what is the subacromial space, we will understand almost instinctively what all of the issues are. Subacromial space is basically the space that is between the humeral head inferiorly and superiorly with the acromioclavicular joint as well as the coracoacromial ligaments. So these are the borders, and usually is between 1 to 1.5 centimeter in a healthy shoulder, and therefore by definition anything less than that can cause subacromial impingement syndrome. So as we will see, there is going to be two possible ways that a person can develop subacromial impingement syndrome. One is acute and the other is chronic. Acute is usually associated with trauma. For example, somebody falls on the shoulder, this injures and inflames the bursa, or it inflames the tendons swells up, the swelling decreases the space of the subacromial space and cause subacromial impingement syndrome. Another common dynamic is usually during sport, tennis in particular, or any other racket sport. For example, during a serve, which is a very fast movement, as the player is about to serve, they might hear a ripping noise or a tearing noise, which can indicate a tear or a partial tear or one of the rotator cuff or the long head of the bicep. And then the same dynamic of the bursitis is also here. There is going to be an injury, therefore an inflammation, therefore a swelling. The swelling decreases the subacromial space, which causes subacromial impingement syndrome. In the chronic scenario, things gets a little bit more complex because now we have many different factors. Yes, overuse is one of those factors and is the one that is more commonly understood, but there are also other factors. They are a little bit more tricky. For example, we have variations in the shape of the acromion. The acromion is that part of the bone that articulates with the clavicle. And there are three types of shapes that we see in people who are affected by the subacromial impingement syndrome. There is shape number 1 or type 1, which is the flat shape, or shape number 2 or type 2, which is a curved shape, and shape number 3 or type 3, which is also called the hooked shape. These are basically anatomical variations of that part of the bone, and usually either people are born with this type of particular variation, or during developmental age there is usually a trauma that forces the bone to be shaped in one of these three shapes. And usually what happens in people who have one of these variations of the acromion process is that later on in life, as those people that start to age, they can develop degeneration of the tendons or of the bursa or even of the joints itself. Therefore, in this case, the subacromial impingement syndrome is developed because of an overuse, which is predisposed by the variations of the bone. This overuse can create chronic changes throughout time, therefore is a chronic condition, which is very important. This makes all of the difference when designing a treatment program. Apart from the variations in the acromion bone shape, we have several other factors that they can contribute to chronic subacromial impingement syndrome. And these factors, they tend to be biomechanical, they tend to be adaptive limitations of the body, such as postural change or muscle imbalance, especially weakness of certain muscles, as well as some of the ligaments or even part of the shoulder capsule tend to thicken up or tend to tighten up. So let's have a look a little bit some of those changes. First, let's talk about thoracic spine flexion. This is very common and is basically when we hunch a little bit forward, causing the head to shift forward as well. This postural change causes the shoulder to change angulature. In fact, now the shoulders, they are protracted forward. This puts under much more stress the tendons on the rotator cuff, which of course with overuse they can start to thicken up and they are at a higher risks for partial tears or tears, all of which can lead to subacromial impingement syndrome. Next is when the muscles and the trapezius muscles, they become weak. The weakness of this muscle is usually also due to the postural change that we just discussed before. So the shoulders protracted forward, the thoracic spine goes into flexion and the head shifts forward. These muscles are involved in the scapulothoracic movement, and therefore weakness of this creates a disbalance in all of the muscles involved with the scapulothoracic movement as well as shoulder movement itself, and therefore overloads certain areas of the shoulder complex, in particular the muscles of the upper part of the shoulder, so the supraspinatus and the upper trapezius, creating a predisposition for subacromial impingement due to supraspinatus tear or partial tear. Another very common cause is posterior capsular tightness. During the throwing action, there is a phase which is called the deceleration phase. This deceleration involves a lot of muscles as well as the capsule to start to tighten up in order to prevent further strain of all of the muscles in the shoulder as well as the capsule. Well, when this action is repeated over and over again, there are some micro tears that they happen to the posterior capsule, and if this action is not corrected or if the person involved in this action does not rehabilitate the posterior capsule of the shoulder, this can lead to accumulation of scar tissues or also called fibrosis. When this happens over a long period of time, the capsule basically tightens up and effectively it will result in a limited range of movement. This will also lead to subacromial impingement syndrome. A very similar process happens to the coracoacromial ligaments. However, these ligaments, they are superiorly compared to the subacromial space. And last but not least, we are going to talk about bony spur. A bony spur is basically a deposition of calcium around the rim of the joints. If there is this calcium, as you can imagine, this will decrease the volume of the subacromial space and therefore leading to a subacromial impingement syndrome. So as you can see, there are many factors including and involved in the subacromial impingement syndrome. It's not quite a clear picture. And there are milder causes as well as severe causes, and there are causes that can be changed, and there are also causes that cannot be changed, or at least not yet. But how come that there are so many different causes and they are all under this umbrella of subacromial impingement syndrome? Well, this is because usually the signs and symptoms are almost the same and the clinical picture is almost all the same. This is why they are all under this big umbrella of subacromial impingement syndrome. For example, a person who suffers from one of the causes creating subacromial impingement syndrome usually comes in clinic complaining of difficulty in raising up the arm, for example during brushing their hair or washing their head or even reaching up for some shelves. And the pain, it tends to be localized on the front of the shoulder and it radiates a little bit downward towards the arm. Patients usually also complain of pain during the night, especially if they lie on the involved shoulder or if they sleep with the arm over their head. And there might be weakness and stiffness in the shoulder, however, this is usually secondary to the pain. And now let's talk about the treatments. There are many treatments, starting from physical therapy, shockwave therapy, medication and surgery. And these treatment modalities, of course, they are gonna change according to what is the cause of the subacromial impingement. Moreover, there are some very interesting points that the research is showing. First of all, is that there is a strong evidence that shockwave therapy, ultrasound therapy and laser therapy is no more effective than placebo. Personally, I disagree with this point, because I think that these are good treatment modalities, that they are worthwhile to try. Number one, because I have had some people responding really good with one or more of these treatment modalities. And number two, because I think that the research is actually lacking in this area. So the research is not being able to quantify the extent on the possible benefits. Second point to make is that exercise seems to be more effective than no intervention, and exercise combined with manual therapy seems to be more effective than exercise alone. In terms of medication, local cortisone injection and oral diclofenac seems to be more effective than analgesic injections. And then when looking at surgical procedure, in the short term, arthroscopic acromioplasty seems to be more effective than open acromioplasty. However, in the long term, these are equally effective. And lastly, patients who did have surgery because they did not respond to any non-operative measurements, they had better outcome if they had the surgery after experiencing only a short term of symptom, usually between 3 to 6 months, compared to those who waited, so they had a prolonged exposure to symptoms, usually more than 6 months. So now let's just try to summarize a little bit everything, because the amount of information is quite a lot. So we just want to make it into a better, clearer and simpler pictures. We have seen that subacromial impingement syndrome can be caused by many different factors, some of which are due to the body compensation, things like muscle weakness, for example, or things like forward shoulders due to the thoracic spine flexion. These causes of subacromial impingement syndrome, they might very well respond to manual therapy and exercise, especially if addressed earlier. And it's going to be very unlikely that patients who present with subacromial impingement syndrome due to those causes, they are a candidate for surgeries. On the other hand, we have also seen that some of the causes of subacromial impingement syndrome is due to a different shape of the acromion process. In these cases, people are less likely to respond from exercises and physical therapy. They might very well do that, but it's less likely, and they're gonna be much more likely to be candidate for surgical procedure. Okay guys, I hope I've given you an overview on what is subacromial impingement syndrome and also what are the signs and symptoms as well as the treatments modalities. Stay tuned on the channel because I will do further videos on how you can self-diagnose subacromial impingement syndrome on your own, and also what type of treatments you can do on your own, as well as what type of rehabilitation exercises. So I hope that those future videos, they are gonna help you in fighting your shoulder pain if you do have one. Thank you for watching. Have a great day.